What does a healthcare Epic analyst really do? Well, it depends on a number of things. Let's start with who hired you. There are two major places to work if you're an Epic healthcare analyst. Either you work for Epic or you work for one of their clients who's probably a large hospital or a large provider group clinic. So let's say you work at Epic. Now there are two branches. You could be an implementation services representative or a technical services expert. What does implementation services do? Well, your hospital probably just decided to buy Epic as the software to run and do multiple things, so they would do the groundwork, help you with the implementation and the go live. This takes about a year, maybe a little more if you have a very large hospital. And then these people move on to the next client, the next hospital. They also help a lot during upgrade, and then they deal with the developers for the various features and functionalities that the different clients and hospitals need. Coming to technical services. If you work as a technical services representative at Epic, then you probably deal with 4 to 5 clients on an everyday basis. You solve their day-to-day problems, you see what's coming, and you anticipate what functionalities are needed for the future. So you would also be constantly talking to the developers, but your day-to-day activities is really talking to the clients and seeing what they need, how to solve various things, how to solve provider, physician, pharmacist, nursing problems, and most importantly, how to deal with patients better. Now, let's say you're an Epic healthcare IT analyst that is hired by the hospital. So what would you be doing at the healthcare department, at the IT department of this healthcare organization or a large hospital? Just sitting there all day? I doubt it. There's plenty to do. What you do really depends on your specialty. Epic itself has about 68 different modules. You could be doing oncology work, which means you'd be called a Beacon analyst. You could be doing pharmacy work, Willow analyst, cardiology work, Cupid analyst, operating room work, Optime analyst, etc., etc. 68 of those, but believe me, not everything is so clinical. There's something called an interfaces analyst. Extremely important work because you see messages go back and forth all day. Messages that are derived at the back end because someone's putting in an order, someone's reading an order, someone's generating a report, someone is billing, somebody from outside is actually giving out billing information, somebody else or an insurance company from outside is sending us messages. All those things are captured in interfaces. Doesn't sound very clinical, but extremely important for the hospital. There's also something called a chronicles expert. The chronicles analyst actually does database structures and algorithms at the back end. How the master files are made, how they're created, and how they're intertwined so that the Epic system actually looks the way it looks. So how do I explain what a hospital IT analyst in Epic does all day? Well, let's take a few examples of modules which really span the entire hospital or at least cover a very wide range. You could be an inpatient analyst, which means that everything done inpatient is probably decided or done by you in the system. That would include from the time that the patient is admitted to the time the patient is discharged. That includes the orders, what is happening with the patient, the consults, the notes, the reports, the billing, etc., etc. That's a wide range. You could be an ambulatory analyst, which means anything done outpatient is now falling under you. All those appointments, all those consults, all those notes, if the patient went for physical therapy, if the patient went for same-day surgery and was not admitted. It's a wide range, guys. It really spans a lot of things. But let's focus on one module that I think is even bigger. It's called the orders module. What the order set analyst or the orders analyst does in a hospital really covers a very, very wide range. So what does an orders analyst really do in the hospital IT department? Well, every single order That means medications, procedures, laboratory orders, diet orders, consult orders, physical therapy orders, surgery orders, and anything that is put in the system is probably designed by the orders analyst. Well, wait a minute. Don't all these come out of the box with Epic, something as nice, as pretty, and as mature as Epic? Some of them do, but they need lots of tweaks, lots of customizations, and lots of things to be designed for the specialty that it's being designed for. Think about it. Orders includes an admit order. Orders includes a discharge order. Orders include if I need physical therapy, if I need depression counseling, if I need a medication, if I have to have and be only on a liquid diet. That's an order. So anything that a physician, pharmacist, nursing is probably putting into the system or reading through the system so that the patient gets the care he or she really needs is decided by an order. So that's it. Once the individual orders are designed and placed into the system, the analyst is done. No way, guys. There's also something called order sets. And we don't have one or two of them, we have hundreds of them. These are a group of orders designed for specialized diseases and a specialty so that we know how to treat the patient. It actually gives you a thorough prognosis and a progression. You have consult orders, you have laboratory orders, you have medication orders, etc., from the start to the finish. It could be a set of 50 orders. The analyst sits and builds all of them and tests them thoroughly. The testing actually involves to see that you can reduce medication errors and make sure that efficiency is built into the system. The physician, the providers should be placing these order sets in probably a couple of minutes. They don't have to put in all the details like the dosages, the frequencies, the order name, what is to be done, how many times a day. And multiple orders like these would actually save the provider a lot of time. Once the testing is done, the analyst takes it to all the stakeholders. Physicians, pharmacists, nursing, or anyone else involved. It could be a physical therapist, a respiratory therapist. All of them sit together and validate these order sets. Once it's clinically and technically sound, that's when it goes live into the system. I've told you this in a few minutes, but it probably takes 2 to 3 weeks to do it. Sometimes even more. Order sets are merely a group of orders. Why are they so important? Because they believe in progression and they show you the steps to be done. It really saves a lot of time and reduces errors. Diabetic patients have lots of order sets for insulin. You could go with one or the other. You could go with dosages, the different brands, and then you could track what the patient is doing and change therapy accordingly. If I have a severe infection, you could choose out of the 3-drug regimen, 4-drug regimen, 5-drug regimen. It could depend on my age. It could depend on whether I have coexisting factors, coexisting diseases, and then decide on therapy. Later on, when you have follow-ups, you can even decide to change therapy based on order sets. As I said, it's more and more efficiency. You could spend more time with patients, and it actually reduces errors. Why do all this in the system? Isn't paper good enough? Well, think of writing 55 orders with the names, with the drug dosages, the frequencies, and what is to be done and not to be done. Instead, you could do all of this with a few clicks, less than a minute. You could be spending all that time with patients. You could be spending more time telling them what they should be doing, counseling them, and ensuring that progression is better. Not only that, you can track what happened in the past. If you're a physician seeing a patient this time, but you didn't see them last time, you could still know what happened because you could have notes from other physicians as they're documented within the hospital system. The error rate goes down because writing fatigue goes down. You simply have to bring in the order set into the system and then sign it, just ensuring that you've read all the details. What else is possible? You could bold certain frequencies. The bolded font actually tells the patient and gives them a printout. It tells the patient what to do. Take this once a day. Take it only Monday, Wednesdays, Fridays. Refrigerate the medication. Don't refrigerate this medication because it would clump. It helps in a variety of ways and communication becomes neater and better. If you aren't convinced that this is really important work, let me give you this example. Think of yourself as the physician on call. You're sleeping at night, it's 1 a.m., but somebody calls you saying that they need you urgently because the patient has come in. You can probably look at the history really quickly in the EMR system, in the Epic system, decide whether they need to be admitted. And if they do, you can put in the admit order right before you start driving to the hospital. You're the physician on call. Now the admit order is already placed. By the time you reach, you could probably begin treatment and the patient already has a bed instead of waiting around. Some physicians even talk to patients on the phone. They put in certain orders like antiemetics if they're vomiting too much to stop the emesis so that they can do that and cash in on the time while driving to work for an emergency. There are many such examples which make patient care better, and ultimately that is the goal.